I'm just gonna close the door right here for your privacy, okay? No, my name is Kamal. I'm a nursing student here at Detroit Mercy. Do you know why you're here today?
Just for a daily checkup.
Daily checkup. All right. Yeah, we're just gonna do like a complete head-to-toe assessment. Now, let me just wash my hands real quick. Well, do you mind stating your full name for me?
Bilal Nasser.
Dry my hands. There's no paper towels here. That's okay. Bilal Nasser, and what's your date of birth?
November 14, 2008.
Okay. And do you know where you are today?
I'm at the doctor's office.
Yep. Thank you. And now, do you have any allergies to medications or latex?
No, just peanut allergies.
Okay. No allergies to latex. Now, are you in pain anywhere before we do this assessment? Okay. And of course, I wanted to ask, are you comfortable with me doing this assessment on you?
Yeah.
Okay. Thank you. All right. And now, the first thing I'm just going to be doing is listening to your heart. We're just going to assess your heart and your peripheral vascular. We're doing a peripheral vascular assessment. Now, just wanted to identify a few things for you. On the right side of your sternum, it should be your aortic pulse, and then right beside it to your left, close to your heart, is your pulmonic, right there. Now, just right below it is your herbs, and then under that, beneath that would be your tricuspid, and then right under your nipple would be your mitral pulse. Okay? Now, the best S1 sounds you could hear are from the mitral valve, and the best S2 sounds you could hear are from the aortic. Okay? Now, of course, I just want to listen for 1 minute. Now, of course, just inspecting your chest, it looks very symmetrical. It's not contoured. I noticed there's no pulsations. I don't see any lesions or masses there. Do you maybe take any heartburn medications or blood pressure medications at all? Okay. I don't know why I said that, but there we go. Now, sir, I'm just going to be checking your heart rate. Alright, and I'm just going to set a timer for 1 minute. I can actually listen for 1 minute. Alright, heart rate is 67, and that's normal, by the way. And alright, now I'm just going to be feeling your choroid pulse. It's just going to be right under here. Just going to be feeling for it. Alright, now I'm just going to check the other side. I have to check one side at a time. Alright, thank you. So they're equal bilaterally, and I didn't feel any swelling when I was checking. May I see your arm? Now I'm just going to check your radial pulse. Alright, thank you. And then your brachial. Thank you. Now let me check your other arm. Just checking your radial pulse here. Okay, and your brachial. That sounds good. That feels good. All right, thank you. Now, just they're bilaterally the same, both on your radial and your brachial, and I didn't feel any edema when I was palpating your arm, and just inspecting your upper extremities. You are warm to the touch. Your skin tone is appropriate for your ethnicity. Your hair distribution is symmetrical on both sides. Both your arms are symmetrical. And yes, I felt there was no swelling at all. Okay, and now I'm gonna go under for your popliteal pulse, which should just be right under your knee. So I just need you to extend your leg, flex your leg a little bit for me to feel it. Okay, thank you. Now check for your other side. All right, we're bilateral the same. Now I'm going for your posterior tibial, which is right around the ankle. Just gonna feel both sides. And they're bilaterally the same. And then I forgot what this is called, but this is just checking for your pulse on your feet. Dorsalis pedis, I think it's called. Dorsalis pedis, yes, that's what it's called. All right, and they're bilaterally the same. Now, just inspecting your lower extremities. Your skin tone is appropriate for your ethnicity, and your hair distribution is symmetrical. And I did not feel any swelling at all whatsoever, and you are warm to the touch. So that, well, the last thing I just need to do is just check your choroid valve. I'm just going to be listening for any swooshing sounds, any brooding. So I just need you to hold your breath for me. Thank you. Okay, you can breathe out. Now, breathe in again. All right, there's no brooding sounds. That's normal. Good job, Bilal. I just want to make sure that's still recording. Yep. Okay. Now next, I'm just gonna be doing lung assessment. Now, when I was inspecting your heart rate, I was noticing your respiratory rate, and it was about 16. So it is normal. I could tell that you're not trying to catch your breath. It's not hard for you to breathe. You don't have a history of asthma, correct?
Yeah.
You do have it?
No.
Okay. And I noticed just from your face, I don't notice any cyanosis on your lips or your fingertips. No clubbing at all. It's not pale. It is, like I said, appropriate to your skin tone. I didn't notice any pulsations at all. Now, do you mind standing up for me? Thank you. All right, and you just come right here for the camera. We'll make sure, yep, you're right there. All right, now I just want you to take a deep breath. I'm just gonna put my hands right over here. You're fine. Take it. Just take a deep breath. Breathe in for 5 seconds and then breathe out for 5 seconds, okay? You don't have to hold your breath. You breathe in for 5 seconds, breathe out for 5 seconds, okay? Now, I didn't feel any tenderness or any masses, okay? You're good. No tenderness, no masses at all. Now I'm just gonna put it right for your posterior. Just breathe in for me. All right, thank you. Now, I'm just gonna be listening to your breathing. Okay. So, I'm gonna be listening for your bronchial. So just take some deep breaths. Breathe in and breathe out. Thank you. Now your bronchovascular. Thank you. And then your vascular. Another one. All right. Thank you. I didn't hear any wheezing nor crackles. Usually what I would do if it sounds abnormal, I would have you to cough, but I did not need to do that, so thank you. All right. You can have a seat right back here. Now we're just going to do an abdominal assessment. Just want to ask you a few questions. Have you had any surgeries, any abdominal surgeries in the past?
No.
All right. Do you feel nauseous today?
No.
Do you notice any changes in your appetite, maybe?
No.
No? Okay. Are you taking any nausea medication?
No.
No? When was your last bowel movement?
Maybe like at school.
At school?
Yeah.
You went to school? You went to school yesterday. That was your last bowel movement?
Yeah.
Okay. All right. that does not sound good. Well, just inspecting your abdomen. I notice there's no lesions, no scars or rashes. Notice no pulsation, and there's no distension of your bladder. I don't notice any bulges. Now, I'm just going to be listening for your bowel sounds, okay? And usually, if I don't hear any, if it's no bowel sounds whatsoever, I have to listen for at least 5 minutes on each quadrant. So I'm going to be listening on 4 parts of your abdomen, and I'm supposed to listen for at least 5 minutes if I don't hear any bowel sounds, okay? So in your right upper one, that's usually where your right kidney is and your liver. So I'm just going to be listening to that first. I'm just pretend that I'm listening for 5 minutes. Now I'm going for your left upper. So I'm just going to be listening right here, and that's usually where your left kidney is and your stomach or spleen. Now I'm going for your bottom right one, and that's usually where your cecum is, your cecum and your appendix. Now, your left lower one, that was your right lower one. Your left lower one, that's usually where the descending part of the large intestine is, and then the colon. And I hear some bowel sounds, so that's good, that's normal. Now, I'm just going to be lightly palpating your abdomen. And when I'm just palpating, I'm just feeling for any masses, and abnormalities. Now, I'm noticing that you're not guarding yourself, so you're not in any pain, correct? Okay, that's good. Thank you. All right. Now, do you mind standing up for me? I'm just going to see if there's any tenderness on your kidneys. This is just called the kidney exam. I just place my hand right here, and I just knock. Nope, no tenderness there. Now, checking on this side. Yep, no tenderness there. Thank you. You can have a seat. All right, now. Just want to make sure, is this still recording? Yeah. Okay. So, what I'm going to be doing next is inspecting your hair, skin, and nails. Now, I notice in your hair seems very healthy. It is black. It looks appropriate for your ethnicity. A healthy color. Now, I'm just feeling for any lumps, any masses, lesions. Notice that you have no infestation. You do a really good job of conditioning your hair. Good job. Now, I'm gonna be just looking at your skin and find any lesions, scars, and like I said before, your skin color is appropriate for your ethnicity. So there's good perfusion going on, good blood flow, and now I'm just gonna do a capillary refill. And it refills in less than 2 seconds, so that's really good. Check your other hand. You're well hydrated. Now I'm just gonna pinch your collarbone, just doing a skin trigger test. Yep, and it's elastic, it pulls right back, does not stay. Thank you. Now I noticed this lesion over here. It is symmetrical. The borders are even, and it is one color. Now, if I could measure it, and it's about, I would say, about the same size as my thumb. Now, has this maybe evolved? Has it like changed at all in the last few months? Has this grown at all? No? Okay, thank you. Now, may I see your nails? I see you take care of your nails. They are nice and clean, and you clip them. They're nice and smooth. There's no dirt under them. So that's really good. Did a good job taking care of them. I noticed like when I was feeling your arms are very toned, I could tell that you work out. I did not feel any edema, no swelling at all in your arms or your elbow. Did not feel any popping or crepiness at all either. Now, the next thing I'm going to do, which is ahead, just gonna be inspecting your face. And now when I'm palpating, just let me know if there's any pain at all. Just palpating your sinuses. Any pain whatsoever? No. Okay, good. And now I'm just going to be palpating for your lymph nodes. I don't feel any tenderness or swelling. Now just behind your ears. Now, I notice your face is symmetrical. I don't see any droopiness. Your face is not twitching at all. Your eyes and ears are at the same level. Your nose is at the same level too. Now, I'm just gonna be. All right. Your nose. I'm just gonna be checking inside, looking for any deviation, any blockage, and I don't notice anything. I don't see any draining at all. That's really good. Okay. And now I'm just gonna be checking your ears, feel if they're tender, if they're not, and is there any pain behind your ear? Okay, and I don't feel any popping there either. That's really good. All right, just gonna be checking your ear, and I don't see any foreign objects in there, and there's no drainage, so that's really good. Well, thank you. I just want to do like a quick whisper test. Do you mind scooting your chair in, like a little more to the middle? Let's just check this. Okay. Hopefully you can hear me. All right. I'm just gonna do this simple whisper test. I just want you to cover one ear for me. Yep. All right, and then I just want you to repeat after me, okay? ABC.
ABC.
Good job. Now cover the other ear. 1, 2, 3.
1, 2, 3.
All right. Good job. All right. Now, sun is like, there we go. All right, you passed that test. Thank you. Now, I am just going to be inspecting your mouth. Mind opening it for me? All right, good job. Now, I noticed that your gums and your tongue is pink. There's no cracks in your tongue. There's not an over-exaggerated of saliva. There is moisture. It's not dry. May I see under your tongue, please? For any sores, I'm looking for any sores, and I can tell that you take care of your teeth. There's no cavities. Now, do you mind putting your tongue down and say ah? Good. I can see your uvula going up, and I notice that your tonsils are not inflamed. So that's really good. Thank you, Bilal. Do you mind moving your tongue back and forth for me, to side? Thank you. Now, I'm just going to be feeling over your jawbones. Now, do you mind biting down for me? Can you bite down? Thank you. Yep, I can feel that. Now, open your mouth. All the way. Good. Thank you. There was no tenderness there, no swelling. That's really good. Now, I'm just going to be looking at your eyes, and your irises are white, and your eye color is brown, and your eyebrows are even. They're symmetrical. Now, I'm just going to see if your pupils constrict, if they react to the light. So I'm just going to wave this light past you, okay? On one side. And yes, they do constrict. They constrict to about, your right eye was at a 4. Now, let me see your other side. All right, good. And that was a 4 too for your pupil. Good. You okay there?
Yeah.
All right. Now, I just want you to follow this pen. I'm just going to bring it close to your nose. All right, good. Your eyes were not shaky there. That's great. Now, I just want you to follow the pen. All right, perfect. Now, do you mind scooting your chair actually back just a little bit? Thank you. Now, there was no shakiness in your eyes. That was really good. You passed that test. Can you make a few facial expressions for me? Can you try to make a smiley face? All right, good. Now, show me that you're angry. Good. Now, show me that you're sad. All right. There was no involuntary movements. You were not twitching. That's really good. And give me 1 second. Now we're just gonna test your sensation, okay? So do you mind closing your eyes for me? All right. Just give me your hand. And then I want you to tell me, does this feel sharp or dull?
Sure.
Sharp. Thank you. And tell me, how does this feel? Dull. Thank you. All right, and now I just need you to close your eyes again. Give me your hand. Whichever one, does not matter. I'm just gonna draw a letter. Okay, and you tell me what it is.
H.
Try again.
A.
A. Yep. And now your other hand.
A. Wait.
Here, I'm gonna do a different one. Then maybe that was confusing.
Wait, can you do it one more time?
Okay.
B.
B. Yep. So you're able to sensei on both of your hands. That's really good, and you're able to differentiate if it was sharp or dull. That's also really good. Now, now I'm just gonna be. Now we're just gonna do range of motion. Can you try putting your chin to your chest for me? All right, thank you. And now try putting your ear to your shoulder. All right, good. And then the other side. That's great. Now all the way back. Amazing. Thank you, Bilal. All right, and now I'm just gonna be checking your reflexes. All right. You know what to do for this one. So just gonna be checking your reflexes here. Ready? 3, 2, 1. Oh, that move. Yep, that's really good. And then this side too. Just move your arm just a little bit. Thank you. And then this side as well. Awesome. So they're bilaterally the same. Your reflexes, that's pretty good. Now, the next thing we're going to do. Oh, I'm sorry, I forgot to check. See if you swallow. Can you? Do you mind swallowing for me? Okay, I felt that, and I noticed there was like no struggle doing that. Now, just looking at your trachea, it is midline. I don't see any bulges or any masses, and I noticed that your thyroid gland is not enlarged. There's no swelling at all. And there's no lesions or scars, so that's good. And you were able to swallow easily, so that's really good, Bilal. Now, I forgot to do this one test. I'm just going to put my hand over your chest, and I just want you to count to 10 really fast.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
All right, there was no fremitus there either. That's really good. No vibrations. Now we're just going to do like some exercises, some musculoskeletal exercises. For this assessment, I'm just going to be palpating for your spine, so do you mind? I'm just going to be right behind you. Scoot a little forward. Thank you. All right, one step forward. Just going to be palpating. Is there any pain at all?
No.
Okay. Yep, I don't feel any tenderness at all. No crepitus. I don't feel any popping, so that's really good around your neck area. Now, we already kind of did some range of motion. Do you mind scooting back? All right, thank you. And now, I just want you to rotate your head back and forth, so face this way, and then the other way. All right, thank you. You had no problem doing that. Now try doing it against resistance. Try turning your head. All right, good. Try turning your head again. All right, good. So they were bilaterally the same. That's really good. Now, now I just want you to shrug your shoulders. All right, you did that with ease. Now I want you to flex your arms forward. Good, and now extend them behind you. You did, all right, that's good. And you could hyperextend it, that's really good. Now I want you to supinate your arms like this and rotate them. Awesome. Now rotate like this, bring it towards your stomach and out. Okay, there was no tremors, there was no involuntary movements. You were doing that with ease, good job. Now we're just gonna test your strength. So just have your arms like this for me. Yep. So I'm just gonna try to pull them, so try to resist. All right, your biceps are bilaterally the same. Now your triceps, so go back to this. Yep, I'm gonna push, you try to resist. Awesome, good job. So they were bilaterally the same as well. Good strength. And now try squeezing my fingers. As hard as you can. Good, that was really good. Now, that was bilaterally the same as well. Now we're just gonna do some exercises with your hands. So what I want you to do is actually just flex your hands this way, then extend them behind you, like this. All right, good. Now I want you to move your thumb outside of your hand like this on both sides. So adduction and then abduction is inside, or not inside, like to the side like this. So abduction, adduction. Yep. All right, you're doing that with ease. Good job. Now put it inside your palm. Good job. Show me a closed fist. Awesome. Good job. Now I want you to do some finger exercise. So basically, put your finger to your thumb as fast as you can. All right. I don't see any tremors, no involuntary movement. May I see your hand? I'm just gonna. Yep, it does not feel stiff at all. I didn't feel any crepitus, any popping on this hand. No tenderness either. And you have all 10 of your fingers. There's no disformities at all or broken joints. All right, that's really good. Forgot to do some coordination exercises. Do you mind try putting your finger to your nose, finger to nose, finger to nose? Thank you. All right, now try putting your heel to shin. Just drag it down. Yep. Thank you. This side as well. Awesome. Thanks. And now we're just gonna test the strength of your legs. So I'm trying to resist it. Dribble out. Good job. Other side. Amazing. All right. And I think for this one, I just want you to lie down. So do you mind standing up for me? All right. So record it. We're just gonna put this chair right here. Oh, thank you for grabbing that pillow. Hello? Yep. Put it down. And I want to see if they can see you. Yeah, they can see you. All right. So we're just gonna do a few exercises down. So just gonna palpate for your hips, and they seem stable. No pain at all here. Okay, that's good. Now I'm just gonna be. The camera can't really see your feet. Do you mind actually going this way? Yeah, just turn this way so I can see. Okay, yeah, that's good. All right. Now, look at your toes. Seems like you have all 10 of your toes. There's no disformities, no popping. Why are you laughing? There's no popping, no crepitus. It's not tender, so that's really good. Now, do you mind pushing, like acting like you're pressing on the gas pedal? All right, good job. Now try bringing your toes to your nose.
To my what?
To your nose, so like pull them back.
Oh.
All right, good. They're bilaterally the same. Good job. So sorry. Now we're just gonna grab your leg right here. No, nothing. Can I have let me have access to your leg, like try not being resisting. Yeah, thank you. Now I'm just gonna test your rotation. There's no involuntary movement. It is not stiff. Is there any pain at all? No, no pain. All right. So we're just gonna move your knee to the side, and you're able to do that easily. Now we're gonna bring it to this side. So adduction. That's really good. Now, I want you to try and bring your leg down. Like try to resist. All right, good job. And now upwards. All right, that's good strength. Good job. Now to the side. Awesome. Now inside. Good job. All right, now we're gonna test the other side, okay? Leg. All right. Now I'm just gonna take your leg and I'm just gonna rotate it. You can bend your leg. You can bend it. Yeah, you can bend it. Now, adduction, then abduction is this outside. There's no involuntary moves there. You did that with ease. Now we're gonna test your strength. Try to raise your leg. Good job. And then under. Awesome. To the side. Good. Inside. Okay. It looks like both your legs are equal in strength. Now one is weaker than the other, so good job, Bilal. Now I just want you to now supinate your legs, act like they're like windshield wipers. Go side to side with them. Thank you. All right. Yep. You did that with ease. You can stand up now. All right. Last few things that we just have to do. You can come over here, camera. Now, you can stand right here and just close your eyes. I'm just gonna be testing your balance and your steadiness. About 20 seconds. Okay, good job. Now, we're gonna basically do like a sobriety walk. You should be familiar with this. So, you're gonna walk from heel to toe, all the way down, and then come right back. Heel to toe. That's not heel to toe.
What's his?
Heel to toe is like this. Heel to toe.
Oh.
Yeah. Mm-hmm. All right, good job. All right, now when you're coming back, I want you to just walk on your tippy toes. Awesome. Now, when you're walking back there, I want you to be walking on your heels. Like this. Yep. All right, good. And it looks like you have no problem walking. Looks like you don't need any assistance. You can walk back. That's fine. You're not waving your arms to get your balance. You were very steady. Your gait was very steady. So, good job. Trying to make sure that I forget anything. No, I don't think I did. Do you have any questions, Bilal, about your assessment? No? Everything's good? All right. Thank you.